Assalamu alaikum. This is the third lecture from the introduction of the anatomy of the lower limb. So we're still in the conceptual overview, and we are talking about now the component parts, which include the bones and the joints. Now, as you know, the bones of the gluteal region, the thigh, are the pelvic bone and the femur. Now, I will start with the first one. Is called the here is the ball, which is the head of the femur, that situated or resting inside the socket, inside the hip bone. So this is a ball and socket joint. And of course, if you are familiar, this is the hip bone here. So the hip bone contains the ilium, the pubic bone, and posteriorly, which is this is the bone that you are sitting on now, is called the ischium or the ischium. They are connected by the sacrum. Now, if we look to the femur, and our femur is the bone of the thigh, and its distal end, it is the major weight-bearing articulation with the tibia. So this is where the bearing occurring here. The proximal end is more for like locomotion, for the movement. Now it's also articulate anteriorly with something we call the patella. Now the patella is, or the kneecap, صابونة القدم. The patella هي sesamoid bone. So it is situated inside a tendon of a group of muscles, four muscles here of the thigh, anterior of the thigh, يسموهم quadriceps femoris. Now the patella contribute and share articulating cavity of the knee joint. تقريبا يعني المين movement هو of the knee is flexion and extension. أحيانا الفيمر can rotate on the tibia, so there's a medial rotation, lateral rotation. A rotation هذا contribute للocking. If you understand it from the second lecture, we talk about when you are standing fully extended. فراح يكون عندك something we call it locking. Locking إنه هو there is a kind of a small rotation with hyperextension or extensions of the knee. This is particularly when you stand. Now the leg contains two bones. Now the largest bone or the thick bone is called the tibia. It is medial in its position. So now we are talking about the right side, okay? So and it's a weight-bearing bone. So that's why it is thick. So you can see from its proximal end and the distal end. Now the fibula, which does not take part in any weight bearing, and it doesn't take part with forming the knee joint, is the lateral bone. Now the fibula is more precisely responsible for muscle attachment rather than weight bearing, but at the distal end they form like a socket to contribute. It will contribute to the formations of the ankle joint. Now the two bones are connected together by a very thick membrane called interosseous membrane. As well, the fibula articulate with the fibrous joints with the lower end of the tibia, the proximal end. Okay, they call it the proximal tibiofibular joint, and inferiorly it's another fibrous joint here is called the distal tibiofibular joint. So although the length could be similar, but the fibula extended a little bit downward, so it will have something we call mortise, and this mortise thing is like a socket for a bone called the talus. Now the talus articulate with the tibia and the fibula at its lower ends of those two bones, forming the ankle joint. Now that will help in like making the movements more the dorsiflexion and the plantar flexions more flexible. Now the foot consists of tarsal bones, and you can see like the tarsal bones here. We have 7 tarsal bones, which are organized like in 2 rows. So we have the talus, which is mainly concerned with the ankle joint. So there's an articular surface for the ankle joint, um, and then we have inferiorly we have the calcaneus. The calcaneus is the bone you stand on, as the heel bone. We have a more medial toward the navicular. This is a kind of intermediate bone. And then we have this row of bones here, starting from the lateral to medial. This is a cuboid, and we have 3 cuneiforms. We have the lateral, intermediate, and medial cuneiforms. This is the distal row, 4 bones forming the distal row. And of course, we have the proximal row. We have the talus and the calcaneum. And there is intermediate one between, what's called the navicular. So 2 rows, 7 bones forming the tarsal bones. Now, after the tarsal bones, we can see that there are 5 metatarsals, and those metatarsals articulate with the tarsal bones, the second row of the tarsal bones, or what called the distal row of the tarsal bones. So we have 5 with the the 5 toes of the foot. Now, those metatarsals, they are connected in their distal end with a very thick transverse metatarsal ligament, and that's connect them to the phalanges. Now the phalanges here, we have 3 phalanges for every toe, except for the big toe, which have 2 phalanges only. So 3 for every of those toes and 2 for the big toe. Now, what kind of movements can happen here? Well, a lot of movements: flexion, extension. There is abduction, adduction. Okay, so there are some, although it is restricted by this transverse metatarsal ligament, but again, you know, it's there is a kind of movement in between. Now, the metatarsophalangeal joints allow all these kind of movements, but the range of movement is more restricted if you compare it to the hand, for example. The interphalangeal joints are hinge joints, and they allow only flexion and extension. Barely they can do other movements. Now, the bones of the foot are, because they are not organized in 1 row, or so it's in one singular plane, so they lie flat on the ground. So when you put them on the ground, they become flat because they are different rows, like proximal row, distal row, and then metatarsal. So when you put them, they will be flat, more or less flat. So rather, the metatarsal and the tarsal, they form longitudinal and transverse arches. Now, those arches is so important to the feet. So we have a transverse arches, and those transverse arches between the metatarsal. Okay, longitudinal arches, we have 2 arches. Now we have a deep one medially, so that is the medial arch. Okay, and that's many bones contribute, of course, ligaments and muscles as well to give support. So many have the calcaneum, and of course we have the navicular and some cuneiform. Okay, so that's the medial arches, is the deepest one. Now there is a more shallow one on the lateral side, and this is again formed by bones here, so it's like the calcaneum and the 5th metatarsal, some cuneiforms here. But again, there are some ligaments here supporting this and muscles. We will talk in details about those arches and how they are supported And the problem, what happened if you don't have those arches, you will have a condition called flat foot, and then we will describe it in more details on our forthcoming lectures. Thank you.